Good afternoon, ladies and gentlemen of the media. Today, I am joined by the Minister of Health, Minister of Education, and the Minister of National Security. Today's press conference is taking place from the cafetorium at the Barclay Institute. We will host future COVID-19 update press conferences from this location to ensure those who participate can exercise appropriate social distancing. I will give an update on COVID-19 testing, discuss the shelter-in-place measures that went into effect on Saturday at 6 a.m. I have an overview of the Childcare program for essential workers, which will be delivered by the Minister of Education, and details about the British Airways flight that landed this afternoon. On to the COVID-19 health update. I'm extremely sad to have to open today's press conference to share with the country that we have had 2 COVID-19 related deaths to report today. We learned that, sadly, over the weekend, a middle-aged individual passed away. This individual had shared a household with a person previously identified as positive for COVID-19. Consequently, a test was ordered on the deceased immediately, and today that test was found positive. It appears that this individual was not in good health generally, so at this time, it is not possible to ascertain the exact cause of death. As required, this will be investigated by the coroner, so for the time being, we are not able to share any further details. The second individual is a senior who had been hospitalized and was one of the cases identified on the 4th of April. This person was in stable condition yesterday, however, passed away earlier today. Out of respect for the families of the deceased, we ask that the media and members of the public allow them the time to grieve privately and respect the very sad loss they have experienced at this time. In addition to this very significant development, routine testing has continued. 11 additional test results were received today, of which 9 were negative for COVID-19 and 2 were positive. This means that the total confirmed positive cases in Bermuda now stands at 39. 1 of the new cases is hospitalized in stable condition. This was an imported case, and the flight details for the case are on a Delta flight on the 13th of March, 2020. The monitoring period for all other passengers ended on the 14th of March. The person was not symptomatic on the flight, but became ill within 14 days of returns. The symptoms worsened and the patient was hospitalized and tested. The second positive result is the first individual I spoke about who passed away yesterday. Out of the 39 cases, 17 people have recovered, 6 are hospitalized in stable condition, and 14 are active cases under active public health monitoring. And as I stated earlier, today, sadly, we have 2 deceased cases. The average age of the confirmed positive cases is 47 years old, as is the median age. The age range is from 18 to 83 years, and the average age of those hospitalized is 71 years old. Of the 39 cases, 23 are males and 16 are females. A review of our overall testing numbers show that out of the 306 tests that were conducted, 39 were positive and 241 were negative, and there are 26 pending results. Following a meeting with the Minister of Health this morning, the government looks to significantly increase its testing regime and aims to complete a significant number of tests over the next 7 days. We aim to be testing frontline workers, such as healthcare workers and persons who are working in our nursing homes and persons who may have been exposed to confirmed cases. As of today, there are 52 persons who are under self-quarantine with public health supervision. However, with the BA airlift arriving today, there are additional persons who will be quarantined at the government facility, and those numbers will be updated tomorrow. The shelter-in-place order started at 6 a.m. on Saturday. A minority of the people in the country chose to ignore the rules that were put in place for everyone's safety, jeopardizing their health and the health of others. To those persons, I say, stop. If you do not care about yourself, think about your fellow Bermudians who are already hospitalized with this disease. Think about the countries that have seen their health systems overwhelmed and from those suffering with the virus. Think about the Bermudian families who have lost loved ones and are grieving tonight. Shelter in place is a sacrifice that in the long run will benefit our country and will save lives. To this point, 2 defendants appeared in plea court today and were granted bail in the amount of $3,000 and to appear at a later point in time. The simple message here is for those who choose to ignore the shelter-in-place order, we will prosecute. Over the weekend, there were questions asked about who can go out and when. To be crystal clear, if you are not going to the grocery store, pharmacy, or gas station, or work for a critical service, or attending for medical treatment, you should be at home and not on the streets. You can exercise on foot within 1 kilometer of your home for an hour. I've seen the app created by one of our local IT companies where you can put in your address and it shows you the areas in which you can exercise. Otherwise, you must be on your property. Essential visits to the grocery store and the gas station should be made on specific days of the week according to your last name. If your last name begins with A through L, you should shop on Mondays, Wednesdays, and Fridays. If your last name begins with M through Z, you should shop on Tuesdays, Thursdays, and Saturdays. Where practical, only one member of your household should travel for groceries, and this must not be a person who is subject to quarantine or required to be in isolation. Single parents of young children may take their children with them. Other than in this scenario, I strongly discourage children from attending the grocery stores. Everyone must have a valid ID, and all forms of ID must have your name so it can be checked and verified. And if you do not have an ID, a utility bill can also be presented. Regarding Sundays, we are looking to reserve senior citizens over the age of 65 and those persons who are physically challenged to make those visits on Sundays. Seniors in the physically challenged can also go on any day that corresponds with their last name, but we are trying to set Sunday aside for them. These measures are not for some and for others to disobey. These guidelines should apply to everyone. So I want to thank also the grocery stores who are letting our essential workers go to the front of the line. It is a great thing for them to do, and it shows how our private sector is valuing our essential workers who are working on the front line to make sure that during this period in time, we can continue to have the essential services that we require. The only way that we can be safe and stop community spread of this virus is to stay at home, except to make trips for essential items as I outlined. So, it is not okay to go outside into a park, which are all closed, to play a sporting activity. You cannot visit friends or family at a different residence. This is now the time for all of us to stay home. If you have received an exemption from the Ministry of National Security, it is up to you to show your valid ID together with the necessary documentation. Over the weekend, the government also recommended the use of homemade masks when going out in public. It is important to remember that masks by themselves will not protect you from contracting the coronavirus. But what a mask will do is it will help you to prevent you from spreading the virus to others if you are an asymptomatic spreader of the virus. So, as that advice was given, and there's going to be additional advice which is going to come from the Ministry of Health, if you are going out, we encourage you to wear a homemade face covering, and instructions for that can be found on the website coronavirus.gov.bm, and they are simple to put together from anything that you may have inside of your home. When you wear a mask, you must continue to practice social distancing, you must continue to wash your hands, and you should maintain 6 feet distance between yourself and others. In the Christian calendar, yesterday, Palm Sunday, marked the beginning of Holy Week. This Friday is the public holiday known as Good Friday. The Christian observance of this day is not subject to change, and for those who share this belief, this day will have its customary significance. However, our current national state means that we cannot enjoy some of the community traditions we enjoy that now accompany this public holiday. Additionally, Good Friday is one of those days when shops, by law, are closed. With the restrictive guidelines already in place around grocery shopping, I am reluctant to remove a day from the limited times when people can get their supplies. As a result, I have asked the Minister of Finance to exercise his authority under the Public Holidays Act 1947 to allow those permitted businesses operating under shelter-in-place regulations to remain open on Friday, April 10th, if they wish. It is completely voluntary and up to the stores themselves. Subject to the public health advice at the time, my hope is that we can partake in the community traditions that are the hallmark of this time of year later this month. This afternoon, the airbridge flight from London and then going on to the Cayman Islands arrived in Bermuda at 1:45 with some 129 returning Bermudian residents on board. Those travelers were processed at the airport and immediately taken to government quarantine facilities, where they will remain for the duration of their mandatory 14-day quarantine period. It is understood that there is a flight also coming in tomorrow from Florida, and it is reminded that family and friends should not go to the airport as it is not a permitted business, and anyone that is going to the airport, family or friends, is violation of the shelter-in-place order and may be detained by the Bermuda Police Service. It is encouraged that you communicate with your family and friends who may have returned today or the ones that are returning tomorrow by social media, cell phone, and other electronic methods, but they will not be allowed to visit. Likewise, those who are in self-quarantine are not permitted to leave their rooms. The Bermuda Police Service and the Royal Bermuda Regiment, working with the Ministry of National Security, will ensure that strict quarantine guidelines are maintained. To the returning Bermudian residents who registered with the London office and were unable to get on today's flight, Kimberly Durant and the London office are working with Government House and the Foreign and Commonwealth Office on the possibility of putting on another flight for returning residents in the coming weeks. That flight may provide opportunity for those residents who wish to leave Bermuda for the UK to buy a seat on the return flight. A crisis like this can bring out the best in everyone. It can also put people in unprecedented and unfamiliar positions where they need help. I wish to provide tribute to the generosity of all the corporations and individuals who have stepped up to support the delivery of essential services to the most vulnerable in our community. Donations and pledges have topped $400,000 from over 50 companies and individuals to the emergency fund set up for this purpose. Allocations from the fund are anticipated to surpass this amount as of yesterday, and we hope the public will continue to give as the needs are great and are expected to grow. Last week, $140,000 in emergency funds were distributed to 10 organizations. An additional $311,000 will be deployed. Will be deployed based on yesterday's assessment of essential services and needs. This money is being spent in areas critical to helping us manage this pandemic based on international standards for national disasters, and in tandem with the priorities of the Emergency Measures Organization and the Disaster Risk Reduction and Mitigation Team. We have to make sure that our most vulnerable people are fed, our homeless are sheltered, women and children who are at risk are housed safely. We have to ensure that people who need medication have access to it, and those who find themselves struggling to cope know where they can get help. Groups like the Salvation Army, Red Cross, and St. John's Ambulance, who were active before this crisis, continue to provide the most essential support to our community, and they deserve our thanks. 14 food distribution services are going to receive almost $100,000 in help to distribute meals, groceries, and vouchers to the people who need these services before this crisis and people who are now finding themselves needing help. Almost $80,000 in support from the emergency fund has been allocated to 21 nursing homes, helping them to get phone and Wi-Fi connectivity. This will allow the hardworking staff to deliver health services to seniors in nursing homes and also allow those residents to stay in contact safely and securely with family members. Groups that are providing shelter and a range of services for people who have substance abuse conditions will receive more than $100,000 to continue their services. The Aging and Disabilities Team, the Bermuda Health Council, Age Concern Bermuda, Vision Bermuda, and the Bermuda Housing Trust, and dedicated volunteers are working hard to ensure that seniors in nursing homes and in private residences are getting their needs met. We are also grateful for the roles that family members play in supporting seniors to stay safely in their homes. On behalf of these and other groups who support seniors, I must also remind you that our seniors are the most vulnerable to this COVID-19 virus. If you are taking care of an elderly family member, please take all necessary precautions before helping them. Thank you to the numerous volunteers who have kept these critical services going, and you can learn more about the essential services that are supporting this community online via the government website coronavirus.gov.bn. Last but not least, I would like to acknowledge the collective behind-the-scenes work of the Third Sector Coordinated Crisis Response Effort, comprising the following partnering organizations and individuals, with support of even more people too numerous to mention here. But I'd like to recognize the Bank of Bermuda Foundation, the Bermuda Community Foundation, Bermuda Health Council, the Interagency Committee for Children and Families, Age Concern Bermuda, and dedicated individuals who aren't affiliated with any organization but step forward to give their time to make a difference for Bermuda. We ask that you please keep contributing to the emergency fund at www.bcf.bm to help ensure Bermuda's most vulnerable people are safe, secure, and continue to be provided for. I will now hand it over to the Minister of Education, who will give an update on the child care program for essential and critical workers. Minister.
Thank you, Premier. Good evening. I am pleased to report that the child care program for children of our essential services workers commenced last week, Wednesday, April 1st, 2020. The operation of the program is needed for children of our frontline workers as they provide much-needed services to our country during the COVID-19 pandemic. Only one site is operational at this point at the Semi-Wilson Central Zone Center on Angle Street. Another location will open as the demand for childcare from our essential service workers increases. The Department of Environmental Health developed a protocol for the camp, and strict measures have been put in place so that social distancing is practiced with the children and the child care providers. A minimum of 3 custodians are on hand each day to ensure continuous cleaning and disinfecting throughout the day of surfaces frequently touched by students and for the heightened cleaning of bathrooms. The child care program this week will be activity-based as children continue to be on extended spring break. Next week, the program will be structured with academic work during the mornings and activities in the afternoon. Children are encouraged to bring their electronic devices to do any pre-assigned schoolwork. The Department of Education will have education officers on site during the mornings of next week to support the children with their schoolwork. The Department of Education's officer for counseling will be readily available to provide counseling services for children if needed. The safety of every child is essential. Therefore, a nurse from the Department of Health will be making visits to the community center to screen the children. The Department of Youth and Sports IT officer will be on site initially to ensure students and the child care providers can work with any online platforms during the morning academic sessions. Today, I was informed that some of our essential workers did not drop their children off to the site this morning due to the shelter-in-place enforcement. However, I want to emphasize that this childcare service is specifically for the children of all of our essential service workers, and they can drop them off for care from 7:30 a.m. mornings. In closing, let me say that although the Ministry of Education was tasked to organize the child care program for our essential service workers, this would not have come to fruition without the direct support and commitment from the team at the Department of Youth, Sport, and Recreation. So I take this opportunity to thank the officers from the Department of Education and the Department of Youth, Sport, and Recreation who planned and organized the child care service. Additionally, special commendations are extended to the staff and team of child care providers at the Department of Youth and Sport who will be overseeing the operation of this program. This team of workers has been on standby, ready to lend support when first called upon, and they were instrumental in helping with the logistical planning of the program from the start. We certainly appreciate their commitment and willingness to run a safe and healthy program for our children, for the children of our essential service workers, so they can continue to fight the COVID-19. Thank you.
Thank you, Minister. As I've mentioned previously, the government of Bermuda has created a WhatsApp update group where individuals can send a message to subscribe for information, news, and official updates. To sign up, WhatsApp HI to 504-6045 and add the number to your contacts list. And you can see that number on the sign below. Since this communications channel was launched, some 2,600 people have subscribed, with more joining daily. And the reason why it's important is because, again, today, there were a number of unsubstantiated rumors that were circulating regarding multiple flights that were coming into Bermuda with a volume of 600 returning residents. It is irresponsible to forward on messages, and if you want to make sure that you receive accurate, timely, and up-to-date information from the government of Bermuda, please go ahead and sign up so you can receive that information direct to your phone, so you do not have to worry about whether or not the information of which you may be receiving is true or not. To many of us, Holy Week represents resurrection. It represents hope. Life at this point in time may not be what we want it to be. And yet we must remain together and unified and hopeful as a country that we can emerge from this pandemic a stronger and better and more unified country. Tonight, I want to end by again giving my condolences on behalf of the government and the people of Bermuda to the families tonight who are mourning their loss. And I sincerely hope that all of Bermuda will pray for their families and recognize that if we do not follow our instructions, if we do not observe the guidelines which have been laid out, there will be more persons who sadly will succumb to this illness. It is important for us to do our part so we can keep that number as low as possible. Thank you. And at this time, I'm happy to take any questions.
Good afternoon, Mr. Premier, and good afternoon, ministers. We've recently heard that the Cayman Islands are expecting to receive some 200,000 testing kits. So I was hoping I might be able to get an update on our testing kits.
Sure. Hi, good evening. Actually, as I've said previously, we are, with all favor, attempting to secure additional testing kits from all manner. We've got our sources that are exploring the procurement of them for Bermuda within the United States, within Southeast Asia, as well as within Europe. You would appreciate that there is a worldwide shortage of testing kits, and we are actively pursuing all areas. In fact, when I was with the Premier this morning, he had contact with the Premier of Cayman. Is he called Premier? Mm-hmm. The Premier of Cayman, to discuss that aspect with respect to the testing kits and the sourcing of same. But we have every single avenue being explored so that we can increase our capacity. As you know, we do have the real-time PCR, which is a similar facility that they have in Cayman, so that we have the mechanisms, but we need to ensure that we get the testing kits. And regrettably, there is a worldwide shortage. Many of the avenues that we've explored initially in the United States and we've been waiting for since February are challenged insofar as it seems to be a bottleneck where they're at the courier, but they haven't been delivered yet to Bermuda. They've been logged and identified as belonging to Bermuda, but we haven't been able to receive them. So again, we are looking to facilitate as many avenues as possible so that we can procure sufficient testing quantities for Bermuda. As the Premier said, we want to test.
Yes,
Now,
you would have heard of my comments that I said that following a meeting this morning, we are going to be significantly ramping up our testing regime, but I don't want us to focus on numbers. Last week I said that we were receiving on the BA flight today the capacity or the reagents to do 40,000 additional tests. The fact is that volume of tests, there are lots of aspects that go into a testing thing. So I don't want us to focus on the overall number. What is important is that we will have the equipment and the resources to test the people who need to be tested. And as you heard from my responses, we're going to expand. The Cayman Islands may get 200,000 tests on a plane, but they're not going to test 200,000 people in the next 2 weeks. And I think that it's important. So those volumes of items, as I said, of a donor had assisted in getting 40,000, the equipment or the ability to have those things. There are multiple parts that go into these various testing components. And so from that particular aspect, I don't want us to focus on large numbers. I want us to focus on the fact that we will have the capacity to test the people who need to be tested. And following a meeting with the Ministry of Health this morning, I'm confident that we're going to be able to expand that testing capacity even further.
Now, over the last few weeks, we've heard a lot about cases that are still under investigation as far as where the source of the virus came from in that particular patient. Can you give me an update on how many cases are still under investigation, and what is the sort of threshold for when the government says that there is community spread?
Yeah, sure. With respect to the cases that are still under investigation, there are four cases that are still under investigation. And as I've mentioned previously, what that means effectively is that the contact tracing still hasn't been completed. Say, for example, an individual it tests positive for COVID, and let's say that they live with a multitude of family members, then part of that contact tracing requires the epidemiology and surveillance team to contact those family members, see whether or not they may have had a recent travel history or have been in contact with someone else who may have been tested positive for COVID. So it is quite an extensive exercise. So the investigation is still ongoing with respect to those individuals. And the second question that you asked with respect to the transmission, the World Health Organization, I'm quoting directly from them, defines transmission classifications, and local transmission, which is what Bermuda currently is classified as, indicates when there's a source of infection is within the reporting location, location meaning Bermuda. Yeah. So at this point, as is revealed in the epidemiology and surveillance report, consistent with the World Health Organization's definitions, Bermuda's transmission status is classified as local transmission.
Regarding the patients who are still hospitalized, do we know if they are on ventilators or not?
I do not believe they are on ventilators, no. Not to my knowledge, no.
Separate issue, completely. The Coral Princess, which has 22 Bermudians, recently arrived in the port of Miami. I was hoping there's any update as to whether those will be able to make it onto the flight tomorrow.
I'm happy to provide the update as I know it. I haven't looked at my emails for the last hour, so I can't necessarily speak to it. I know that there are working with fever. There's a lot of work that's taking place between the travel agents here, the airlines, the Ministry of Tourism and Transport, the U.S. Consul General, to look to get them on that particular flight tomorrow. It is hopeful that they'll be on that flight, and I know that there's all avenues of working towards that. There were some complications and challenges there. There was a plan that was approved, but with things that are changing so rapidly in the United States, it becomes difficult, but we remain hopeful. But I do not have an update at this time. As I had seen about 3:30, there were emails that people were going back and forth. Someone had sent me a message on social media asking to intervene, and the Ministry of Tourism and Transport is working with the relevant government agencies to try to make sure those Bermudians get back on that flight.
Now, of course, so that cruise ship, along with several others that have been affected by this pandemic, are registered in Bermuda. Do you know if there's any sort of risk of backlash to us as the regulatory agency, but the country in which they fly their flag?
I don't believe so. I don't know what type of backlash you might be talking about. Do you want to be more specific?
For example, the Ruby Princess, which is it's been raising some controversy in Australia because it left a number of passengers who had the illness, or at least flu-like symptoms, and released them into Australia without notifying anyone. We have heard that there's potential of lawsuits, and of course they do fly under the Bermudian flag.
I would say that under maritime law, it would be according to, and it will be adjudicated in either our courts or some other courts according to maritime law and existing international regulations.
I think that's everything I have.
Good evening. For you as a premier, how tough was today for you?
Don, all the days are tough, but the day that I have today is not as tough as the families who are grieving. Our job is to make sure that we're doing the work which is required. And I think what I would say to that is that for the companies that are trying to find each and every way in order to remain open during this time, I'm just going to tell them to cool out and relax. We have 2 weeks in which we are trying to restrict movement as much as possible so that we can come to grips with the level of transmission which may exist inside this country and to prevent it from taking place. And I cannot stress how important it is. So the stress that I have is nothing compared to those persons who are grieving, but it is increased when there are so many persons that do not believe the rules apply to them. They apply to everyone, and the government has been very clear and has laid out those rules very clearly, and I'm thankful to have the support of the Minister of National Security, the Commissioner of Police, the Commanding Officer of Royal Bermuda Regiment, and Government House saying that we are going to enforce the rules as they exist, as it is necessary to do so.
Would you say that Buzz is one of those companies that are trying to skirt by the rules? So you had told them to cool down a bit this morning.
I would say that there's lots of various companies. Buzz is not the only one. There are many that are looking to find a way to remain open. And we have been very clear and prescriptive. The purpose of this week, these 2 weeks, are for as many persons as possible to stay at home so we can reduce transmission that may exist in the country to save lives. And for those persons who, for some reason, did not think that that applied to them, the evidence is real today. Bermudians are dying. It is important. Stay home.
You mentioned a more aggressive regime now that we have the test for the hospital workers. Will that include also doing the double negative test for recovery rather than a waiting period?
I'm not entirely certain if we're there at that point in time yet, but we're happy to provide an update in the future.
One person today was traveling from Hamilton Parish. They were trying to get to Lindo's for grocery shopping. They got stopped at the checkpoint at the aquarium and told that they had to shop in Hamilton Parish, and there still seems to be some confusion as to where they can do their grocery shopping.
Don, we are, as the Premier said, we are now have to implore to the people of Bermuda that this is now situation critical. The Bermuda Police Service, we've seen their numbers. There are a number of people that are simply not taking this seriously. There are people traversing all over the island that do not have the right, that will be held accountable in law. If you are in the eastern parishes, we're asking you to go to a grocery shop that's in the eastern parish. This is something that we're requesting because we simply do not want people going all over the island to grocery shop, and we're trying to minimize movement as much as possible. Again, to reiterate the Premier's point, we are trying to keep people at home in accordance with the law. If people do have to shop, we've given specific days when people have to shop, and we've given recommendations over and over and over that if you can shop in the part of the island that you live in, that will be most beneficial to us all.
Thank you. Education Minister, the issues with the BUT today, what progress has been made on that?
Well, Dawn, first I want to say that personally I'm very disappointed in the stance that has been taken. The issue that has prompted that stance is something that happened in February. It was dealt with in February, and all parties were made aware of what would happen if they continued along that route. And the Commissioner of Education, instead of those deductions being made in this month's salary, elected to delay them until after the situation we're dealing with has been handled. The two things have nothing to do with each other. What happened in February has nothing to do with the crisis we're fighting now. What I do want to do is again, thank the teachers that have stepped up and have done the things that they need to do to ensure that education continues. I also want to thank those teachers that showed up this morning to their Zoom meetings. I have a report from the Commissioner that most of the meetings went very well, and we're well underway in getting into what we need to in order to move forward with our education system.
All right, thank you.
Would you like for the Commissioner of Police to share some operational updates with what will be transpiring in the next 24 hours?
Okay.
Thank you, Minister. As has already been highlighted, we are seeing a continuing, albeit small, trend of people that are not observing the regulations and the related guidelines. We've seen some parties arrested overnight for breaches of curfew, and they have appeared in court this morning. The concern I've got, though, is that people, as mentioned by the Premier, appear to be going about their normal business and the rules do not apply to them. We are going to be increasing the number of community advisory points from tonight and into tomorrow to double the amount across the island. This will impact people. They will be slower to travel, but the issue is to get clearly the advice across to address people who continue, and I use the word, flout the guidance given to them. This is about something that is very small for people to do, but actually is significant for others. And I used the term the other day on social media of shutting up and putting up, and I'll use it again, because some of the excuses for people's travel is quite ridiculous. And we need to actually get the message across in regards to the government guidelines and actually get people to comply. So people will be given direction, and there may be more affirmative action against those that choose to ignore that advice. So I ask everybody to follow the guidance, work with us, not against us, and we can achieve our objective.
Sir, can you share some of the excuses that you and your men have received?
Well, I think one's touched upon, about people's choice of grocery. And they
Commissioner,
feel that,
speak directly into the microphone. People can't hear you.
thank you. People wanting to choose where they shop, people who feel that exercise can be done multiple times across the day, people travelling far outside the half mile of the exercise, one that's been raised around cycling, and I know it's a frustration, but it is about keeping people within the vicinity of their home. Socially distanced, so we can actually address issues, and then that we can allow movement across the island for critical workers and also people to go and do their essential trips. So there are a vast majority of things, even people arguing around their surnames because they have a double-barreled name. They're such small issues, but they're being put on us to address, and actually we're just asking people to be sensible, take responsibility and follow the guidelines.
Any other questions?
I believe that we need to throw more resources at this. The Premier has given me a responsibility. He's reached out to me today. He's asked me to pay a little more attention to enforcement. I do believe that he's right, and I will ask His Excellency the Governor to increase the Bermuda Regiment's embodiment to approximately 250 soldiers. I believe that we now have to ensure that Bermudians are respecting this shelter-in-place, and it does not appear that a number of people are getting it. In one neighborhood this past Saturday, a DJ was in his neighborhood and he was playing music and people were gathered around as if it was cup match. Last evening in another neighborhood, the exact same thing, DJs in the neighborhood and everyone in the neighborhood gathering, barbecuing and having a good time. The neighbors who were so offended by this called the Bermuda Police Service, and the Bermuda Police Service had to go to that neighborhood to remind everyone that we were indeed in a shelter-in-place. When we hear about those sorts of things happening around the island, we believe that we must now scale up because of the significance of what we are going through as a country. And I will ask, again, His Excellency the Governor, to increase the amount of embodied soldiers immediately.
All right. Any further questions?
Minister Keynes, just as a follow-up on the grocery store question, I've had a couple people in the eastern parishes make the observation that there's less grocery shopping available.
John, with the greatest of respect, we can figure that out. I don't think that we need to take time in this interview to keep going through the grocery stores. We all live in Bermuda. We know where the grocery stores are. People need to figure it out, and I think we have the ability to do so as a country.
All right, thank you.
All right. Thank you. In closing, just a reminder, as I remind every day, I want to give thanks to those persons who are working so hard on the front lines to keep us safe. And I want to just send a reminder out to all persons that the reason why we have this 14-day shelter in place is for us to stay home and to protect our country. If there are repeated violations of this shelter in place, it will defeat the purpose. And if we defeat the purpose of this, that means that we will have larger local transmission, possibly leading to community transmission, which means that these measures may have to be extended or there may be other pain. None of us want that. Let us take this 2 weeks, which have 12 more days remaining, to remain in place, to observe the rules, and we can all work together to keep our country safe. I wish everyone a wonderful evening, and again, please pray for the families who are grieving tonight as they have lost their loved ones. Thank you.